As the nation witnesses a surge in demand for contraception and access to contraceptive care, this pivotal issue is at the forefront of voters' minds as they prepare to head to the polls. Joining us today is Sarah Kelley, Chief Operating Officer of New Morning, South Carolina's leading contraception access initiative. Sarah, thank you so much for joining us today.
Thank you.
I would like to ask you to speak to the increasing demand that we're seeing here in South Carolina.
Sure. So New Morning is a South Carolina-based nonprofit, and we focus on increasing access to contraception and information about family planning. And we do that through a network of clinics throughout the state. Right now, we work with over 150 clinics and at least one in each of the 46 counties. And those clinics provide contraceptive services, which includes counseling and a method of a person's choice. And what we've seen through our work, which started in 2017, is that over the years we have demonstrated an increase in interest in birth control as the word gets out about what we're doing and people become aware that they can access birth control for free or low cost. And so since 2021 to present day, we've seen about a 30% increase in our costs to subsidize birth control methods for people seeking those.
You said a 30% increase in your costs.
Yes.
So are you saying that birth control is getting more expensive?
It is getting more expensive, and we have seen more utilization of birth control as well. So some of the things that drive the cost are that pharmaceutical companies increase the cost of methods regularly. And so when we're thinking about birth control methods, there's a bunch of different kinds that you can use. There are pills, which I think people are most commonly knowledgeable about. There's patches and rings. And then there are the more expensive methods that are called long-acting reversible contraceptives. And those are IUDs or implants. And right now, out of pocket to get one of those, if you just paid, you had no insurance, it would be around $1,300, which is what New Morning would pay for. And so as you can imagine, for someone who is low income or is uninsured, that would be completely out of reach for them. And so that's why it's important that we are offering that coverage. Mm-hmm. Also, as I said, just because we have been getting the word out about what we do through our educational campaign called No Drama. That's a website that also has other advertisements that go along with it. And it shows any patient the different kinds of birth control methods, the clinic that is close to them where they can get it, also links them to telehealth, and that's at nodrama.org. So anyone can go there and find out information about us. But since launching that website, we have seen more and more increases in interest, including from 2022 to 2023, we saw an increase of 10% in LARC usage among our patients.
Okay, and so if someone is interested in what New Morning has to offer, are there any stipulations of someone getting help from New Morning?
Yeah, so if someone is interested in getting birth control through our service, they can go to nodrama.org, and there are lots of answers there getting at who qualifies. But in short, really, if you are low income, uninsured, or underinsured, then you would qualify for our services. And if you go on the website, then you can put in your zip code and it will show you the closest clinic that we work with. And when you go to the clinic, then a provider will talk to you about the different types of methods, the cost of those methods, and which ones are going to be for your low cost through our service. So they'll help you assess whether or not you qualify.
Mm-hmm. And Sarah, can you speak to some of the primary challenges and barriers that we have seen specifically in South Carolina when individuals are seeking access to contraception and family planning services?
Yes. So before we were on the scene, when we started in 2017, there were things called contraceptive deserts. And these were areas of the state where there was little or no access to contraception. And that could be because there wasn't a clinic offering contraception, or perhaps because there wasn't an OBGYN that was practicing. And even now we see some pockets of the state where a third of the counties in South Carolina have no practicing OBGYN. And since we have started our work, we are breaking down some of those barriers to access, making sure that we have more local clinics, and in particular clinics in rural areas for people who live in those places. Because as you know, South Carolina is a very rural state, which means that you might have to get, in a car, borrow a car from someone to go to a doctor's appointment. Maybe there's not public transportation. You might have issues with childcare. You might have a job that doesn't allow you to go to a clinic during normal or typical business hours, which is why we looked at expanding telehealth so that we could make sure that people have access during non-traditional business hours too. And then, of course, I spoke to this, but the cost of birth control really can be something that people cannot afford. And what we don't want is for someone to have to make the decision between paying a bill and getting the birth control that they need.
Mm-hmm. And now, do you need a prescription to get New Morning services?
Yes. So if you go to a clinic, they'll assess you for which method is correct for you and talk to you about which method you want to use. And then they will give you a prescription. There are some methods that are available over the counter. And I'm sure that you've heard some about the law that was passed last year with pharmacy access to prescription medications as well, where you don't have to necessarily go to a clinic, but you can go to a local pharmacy and be assessed for a self-administered method. So like a pill, a patch, or a ring.
Sarah, thank you so much for joining us today and all about the wonderful things New Morning is doing for South Carolinians. And you can visit newmorning.org to learn more about the services. And also they do have a conference coming up in April. Sarah, thank you again.
Thank you.
We're back in 2 minutes.